Hello everyone, my name is Dr. Mohammad Shoaib Ahmed. I am a consultant and intervention cardiologist at Renova Hospitals, Langar House branch. How to diagnose hypertension? Hypertension is also called a silent killer because it doesn't have any signs and symptoms and can go unchecked for years before you develop complications of hypertension. So, in order to diagnose hypertension, you should regularly check your blood pressure so that you can identify hypertension at an early stage. How to measure blood pressure? Many of the people measure blood pressure in wrong way. For measuring blood pressure, you can do it at your home by using automated blood pressure monitors. For that, you should be seated in a chair, should be comfortable, should be resting at least 5 minutes, feet grounded, and your arms should be at your heart level. Then you have to take two readings, and you have to take the average of two readings for diagnosing hypertension. For diagnosing hypertension, you must require at least two readings which should be 1 week apart. If those two readings is more than 140, then you are diagnosed to have hypertension. Then you have to take treatment. Treatment can be either lifestyle modifications or you have to use medications. Next, coming to treatment. The first option for treatment is lifestyle modifications. What are the lifestyle modifications? First of all is stress reduction. Next, good sleep, good undisturbed 8 hours of sleep, and you have to avoid sedentary lifestyle. For that, you have to continue at least 30 minutes of vigorous physical activity, at moderate intensity physical activity for at least 30 minutes or 150 minutes in a week. Other things like quitting smoking and drinking alcohol in moderation. Moderation means less than 2 drinks for males and 1 drink for women. Apart from that, you follow a diet. A DASH diet, we call it as a DASH diet, which includes fruits, vegetables, legumes, and whole grains. You should avoid trans fats and saturated fats. Coming to medicational treatment, if after following lifestyle modifications also your blood pressure is on the higher side, then you have to be started on medications. There are various classes of medication. Which class of medication should be started will be decided by the doctor himself. So first line of treatment is always lifestyle modification. If lifestyle modification is not working, then you have to definitely take medications. So conclusion, hypertension is one of the most common diseases seen these days. It is a silent killer, so you will not have any signs and symptoms of hypertension before developing cardiovascular complications. So it is your duty to check your blood pressure regularly and identify it at an early stage so that you can avoid it by following simple lifestyle modifications. Now coming to myths about hypertension. Majority of the people think that after using medications, once their blood pressure comes to normal, they can stop the medications. No, you can control your blood pressure with the help of medications. But you cannot cure hypertension altogether. So in order to control your blood pressure, you have to continuously take medicines. Another myth for hypertension is that hypertension is a disease which affects only older individuals. No, these days we are seeing many people who are having hypertension between the age of 30 to 40 years. Hypertension is most commonly affecting individuals between 32 and 40 years of age. So hypertension affecting only older individuals is myth nowadays. Thank you.